Faith is a universal language. It binds hearts together and establishes unity amidst diversity. People of like minds are more likely to adhere to common rules and pursue similar goals. Caritas Nigeria, existing as a specialized agency of the Catholic Bishops' Conference of Nigeria (CBCN) for relief and development, has fully understood the role of the Church in the society. Caritas, as a faith-based non-profit organization, is a member of the Caritas Internationalist Confederation, which is a global network of 165 member countries, headquartered at the Vatican but working around the world to help the poor and needy.
As a Catholic church, primarily, the relief and development sector takes care of everyone. We advance the well-being of all through participatory measures in line with the Catholic social teaching. The aspect of non-discrimination is very, very important in this vision. And that's because we serve everyone based on need, and also we believe that there is a right-based approach to development. So if you deserve this, you get it.
With funding and support from the Center of Disease Control and Prevention (CDC) and partnerships with some development partners, Caritas Nigeria executed the SUSTAIN program, a 5-year project aimed at reducing morbidity and mortality due to HIV and AIDS infection in Nigeria. The SUSTAIN project has improved access to HIV and AIDS services in various communities across 12 states of the country. One of the core program areas under this project was the Congregational Approach to tackling HIV and AIDS.
From the start of HIV issues in Nigeria, the Catholic Church and other faith-based organizations have always played significant roles in the intervention. And from the first time the US government decided to fund organizations to intervene in Nigeria, one of the first implementing partners was Catholic Relief Services. It's been known in Nigeria that faith-based organizations have played a significant role in HIV intervention. So the strategy was for us as Caritas Nigeria to just focus on working with faith-based hospitals across the 19 states where CDC was going to implement services. And that was why we, as our Catholic Caritas Foundation of Nigeria, was asked to focus on implementation in faith-based organizations. We started with mapping the faith-based hospitals across those states. And we noticed that from the Catholic Church to the NKST, to the ERCC, to ECWA, Cocaine, to Anglican Church, a number of those faith-based organizations had hospitals across those states. So we mapped those facilities, and we started with the facilities that were already providing services. Based on experience from previous projects, it was also discovered that in terms of quality of services provided to clients, seems to get better services from faith-based hospitals, more time, quality care, and all that. So for us, that was one selling point as an organization.
Making the best use of the relationship many spiritual heads have with their parishioners, Caritas has been able to make many congregations access information about their health status, thus leading to the proper attention and intervention needed to treat and give them a better quality of life.
Working with the church is of great interest because there is a lot of opportunity with the church. There are so many structures that you can work with to achieve your target, especially in terms of health in the rural communities. Most of the people we are trying to reach are in this community with their pastors in place. They listen more to the pastor. So if you go close to the pastor, if you work with the pastor, you should be able to implement most of your projects.
You know, our people believe in God so much. We are God's people. Nigerians generally, God. Anything God, they trust. And church is actually a good entry point to the success of the program. We have over 5,000 clients on care in our facility at the moment. If not for church, I don't think so many people will be willing to openly tell you about their status. If not for church, many people will be stigmatized to death. But through church activities, normally if we are going out for the time of community mobilization and sensitization, we used to incorporate it with churches' activities. We go to Mass for those of us who are Catholics, or congresses arranged for the faithful. You go there, you either tell the pastor to talk, introduce you into it, then you come out and you talk about it, and after that you tell the people to meet you at a particular angle where you go into details, even though you were not going into details in the church like that. So if you go through that, you discover you will meet so many people. Whereas if you wait in the hospital for them to come, very few, only those who are sick will come. So that actually helped the awareness creation. And then after that, knowing that the facility they are going to is faith-based, that trust continued. And anytime they came to the facility, we keep telling them, feel free, talk about it, because confidentiality will be maintained.
By using a strategy called a baby shower, mothers in communities are encouraged to participate in HIV and AIDS testing, counseling, treatment, and other ingenious activities peculiar to Caritas Nigeria.
The goal of PMTCT is to prevent or at least minimize vertical transmission of HIV, which means prevention of transmission from mother to her unborn child. We collaborated with Healthy Beginning initiatives, and we came up with a baby shower integration into PMTCT. What do we do under baby shower projects? Under baby shower projects, all the pregnant women within the churches are brought together. The husbands are provided with gifts to present to their wives and appreciate them for carrying the pregnancy for them. And then we in Sustain also provide them with HIV testing services. Now with this initiative, we've been able to provide HIV testing services to over 10,000 women in the community. And we've also achieved 50% male involvement by testing their partners also within the lifespan of this project.
The baby shower program offered us an opportunity to get tested and health information for free. We also got gifts, and our pregnancies were celebrated as well. My husband and I are finding things really difficult at home. The baby shower came just at the right time to save our faces, despite the challenging financial situation at home. We got gifts that reduced the cost of medical services a pregnant woman would normally receive at the hospital.
Involving not just the mothers, but their spouses has proven to be an effective way of reaching out to the menfolk for them to participate in making the right choices, following up on accessing healthcare and presenting gifts in appreciation to their spouses.
Once we tell them to come to the hospital, when they come, we still continue counseling them and assure them of confidentiality, that whatever they're sharing with us, no one will hear it out there. And if we want to take it out there, it must be with their consent. And a few will come, and the first few days they will give you a little and observe to see whether they will hear it elsewhere. If they don't hear, if they come again, they will open up more. And gradually, if they open up and they develop their confidence in you, they are the ones who tell outsiders that, oh, when you go there, they don't talk about you. And it was through this church that we started forming support groups.
The Congregational Approach of Caritas Nigeria has done very well in reaching its target. Its solemn resolve to maintain confidentiality for the client's sake has gone a long way in encouraging and emboldening a sizable number of people living with HIV to support one another. The desire to join the war against the virus has seen people who have first-hand experience as carriers of the virus take the bull by the horn and become sensitization agents to fellow carriers and to the public at large under the Sustain program.
We started forming support groups through church. So now with the advent of support group, you have mostly the positive ones, and you make them talk about, share their experiences. How has it been? How did it start? How have you been able to cope? So listening to someone who is positive, sharing the experience, helps others too to become courageous and to come forth. And also, through the church too, we were able to get some what we call treatment support specialists, TSS. So we now include them into our staff strength, which was another approach that actually helped. You get those who are positive, that can talk, that can counsel, you bring them into the facility and you have an office for them and they help in counseling the other patients. And that when they are talking to them, they tell them, I am also positive and this, that, and that, and that, this is what has helped me. So for patients listening to one of them, they are able to relax more and then to accept and develop that confidence. So the church became an entry point. Going there, you are able to talk to them more, and then you get a few that you need to give care to.
Church health advisors work with us at the churches. We must be selected from amongst members of the community. And the criteria is that they must know the people very well. Each participant must be attached with one church health advisor. That one see to it that the woman is retained in care. And if the woman failed or there was a misappointment, the CHA that is attached to the participant must go to the community, and we'll make sure it's kept private. Phone calls are preferred, but in the absence of those phone calls, the church health advisor can go to the house.
The end to the menace of HIV and AIDS may not be in sight yet, but like a very distant cloud, an outline is beginning to form. Institutions and governments alike are not relenting and will not relent in the fight until mankind is totally freed of the virus. Soon, cures will be found and distributed for use. Millions of lives will be turned around. We await that beautiful day with bated breath. Until then, Caritas Nigeria, together with other development partners, will continue in the fight because it is our responsibility to make life better for all.
The Catholic Bishops' Conference of Nigeria, CBCN, deeply appreciates the support of the United States government that funded the SUSTAIN project through the President's Emergency Plan for AIDS Relief PEPFAR and the Center for Disease Control and Prevention, CDC. Thank you for helping us bring succor to our brothers and sisters in need.
No so long time ago, there was a small town that harvest food where they received a meal. After being sure that people get what they need, they gather happy and joyful and humble in their acts, which is the sign of the presence of our living God. I'm done with this world.